Welcome back. We're back with Dr. Ali Hassoun, infectious disease specialist from Huntsville Hospital.
Dr. Hassoun, the Centers for Disease Control and Prevention is telling states to prepare to distribute a potential coronavirus vaccine as soon as late October. And just today, the CEO of Pfizer said its vaccine trial may have results in October. So is that a realistic timetable for us to see one?
I can tell you what I would say that's very surprising plan or projection, because we've said it from the beginning. We're going to need a solid phase 3 trials that have enough patients enrolled. At the same time, we would have good data to know efficacy as well as safety. And it will be very difficult by October to know this information, because I can tell you at the moment there is nothing published yet. And it's September now. Nothing published yet about phase 3 data. So it is surprising they saying that. I mean, I wish it can happen, but it's unlikely it will.
British drug maker AstraZeneca joined Moderna and Pfizer in a phase 3 clinical trial, which we obviously don't have a vaccine yet, but how important is it for multiple companies to be in this stage in their research?
I think it's very important because we don't know if all of these vaccines are going to be proven to be effective or proven to be safe. So that's very good and encouraging. We need multiple different vaccines on different phases to know which one is going to be the most beneficial or most likely effective for our patient. So definitely we want multiple in there.
Dr. Hassoun, a recent CNN poll showed 40% of Americans won't get a vaccine when one becomes available. What is your perspective on that?
Yeah, so we've seen it with the flu vaccine. The response and the belief in the flu vaccine been low, and it's hard to convince the community. I think what's important going to be with the COVID or the coronavirus vaccine is how much we're going to tell the public how effective it is, what is the issues with it. We'll be upfront with them about all that information, because I think there is good number of the population willing to take it, but they want to get more information and they want a good advice about it. So 40% is not surprising, because we've seen it the same with the flu vaccine, but I've seen it at the same time as an experience where we get to talk with our colleagues, peers, neighbors, family, employee, where we have the vaccine available. We give them incentive, we talk to them about it, so we might be able to increase that percentage. But we need the data first.
And you're right when you say people want information. People do want that. They want it consistently, and we seem to get more seemingly contradictory information coming out every week. Just this week, the National Institutes of Health says doctors should not use convalescent plasma as a coronavirus treatment until more studies are done. So have you used it, and what do you feel are some of the risks and benefits?
Yeah. And then one of the most important thing about all these therapies of COVID, none of them been FDA fully approved. Research been done on it, but a lot of these research, what we call it retrospective, meaning they gave it to the patient and came back and looked at it and see if effective. I did and have used convalescent plasma, but I really don't recommend it for everyone. I usually recommend it for certain patients who come early in the disease, who have pneumonia, but didn't reach significant inflammation, for example. Like what has been published, I wouldn't recommend it for those who's intubated, because they already passed the point where it might help. There's a lot of factors that we usually look at and see benefits and risk. Risk-wise, we always worry, is there any toxicity, safety issues with it? At the moment, the data that published, it's not very clear. We know there is no acute reaction from it, but we don't know if there's a long-term effect for it. So I'm usually very cautious in using these, but I tell my patient, these are the data, these might be beneficial, and then we make decision together to see if it could be helpful or not.
Dr. Hassoun, with all of the recent numbers and developments that we are seeing and referring to, what do you project is in store for the future over the next few months?
in the way of, I'm hoping there is still ongoing trials on, for example, monoclonal antibodies. There are ongoing for vaccines. There are ongoing for other actually antiviral medication. So there is some hope we might see other options that's going to be available. In the meantime, I can tell you there is good hope. If we apply prevention, it'll be a good idea. Definitely we cut down on the cases in there.
Now, we've been talking to you literally for months now. So how has your level of concern shifted since the beginning of the virus, if it has at all?
My main concern, we still definitely see patients who get admitted to the hospital who's very, very sick. And unfortunately, some of them admit they didn't believe in the coronavirus. They didn't follow the guideline. They didn't follow the prevention, unfortunately. And we still see that on social media. We still see it on regular basis in the hospital. And, I really ask the community to help us, those who got infected, or those who had family got infected, or know a friend, really reach out to those who doesn't believe it and talk out to them about this. This is a real disease. I know it's not a big percentage get sick, severely ill, but those who get sick will have a long-term effect or die from it.
Sobering words, Dr. Ali Hassoun, infectious disease specialist at Huntsville Hospital.
As always, thank you so much, Dr. Hassoun, for your time and your insight tonight.
Thank you so much.